Welcome back to Great Day Washington. This is National Women's Health Week. And did you know that the district has one of the highest rates of breast cancer mortality in the country? Here to help stop that trend is Dr. Jaclynn Powell and Dr. Vickisha Fripp. Both are from Providence Health System. Welcome, ladies.
Good morning.
Now, I want to start with you, Dr. Powell. As a radiologist, tell us about 3D mammography and how it differs from the old school so-called regular mammography.
We're excited to offer 3D mammo. It's also called tomosynthesis or tomo at Providence Hospital. And basically it takes a series of low-dose images through the breast as opposed to normal traditional 2D mammo where it takes one image of the breast in different positions. And the advantage is these multiple images allow you to create kind of a 3D reconstruction of the breast. Which reduces tissue overlap and can improve cancer detection.
That's amazing. So that 3D means a woman can come in and have a higher chance of that early detection, which I understand saves lives.
Exactly.
Yes, and Dr. Fripp, I want to go to you. Let's talk about breast reconstructive surgery. That's so important for any woman who's had a bout of breast cancer. Tell us more.
It is. So breast reconstruction, every patient should be counseled about their options. So if they're a candidate, depends on the extent of their disease, their general medical condition, their body habits, and then their personal preference. So it can range from no reconstruction, that is an option, to implant-based, to tissue and muscle flaps. And so we have the full range of offerings at Providence. It just really depends on what the patient and the physician decide together. And so you have to be counseled or you won't know that these options exist. And so we try to get every patient in before they even have surgery to talk about what to look forward to when we reconstruct that breast.
That is so important too, because I can just put myself in the mind of a woman who's going through cancer and she's just worried about her survival and mortality, and then you get through it and then you have to build yourself back up again. And you guys have that team approach. That's good to know.
We do.
Dr. Powell, you also have MRIs. How does that fold into the women's health and breast health?
We do. We offer MRIs mostly for high-risk women who have, strong family histories of breast cancer or gene mutations such as the BRCA gene. We usually alternate MRIs with mammography as a supplemental screening every 6 months, and it improves sensitivity for cancer detection.
And the MRI, from my understanding, you lay down in that machine and you go in. That's kind of like my old, but it's so cool because it can just really sweep your body and detect so much more, right?
Much more sensitive, yep.
Okay, I love that. And now low tech, that's high tech. Women should be, Dr. Fripp, you say, doing self-breast exams. I grew up with a self-breast exam hanger in the shower. Should women still be doing that with all the advances in technology?
It is the most important thing and probably what I'm most passionate about when I talk to my patients, because you may see your doctor once a year, your gynecologist, your primary care doctor. They don't remember what your breast felt like last year. They have no way of remembering that. You have access to your breast every day, every month. And so I ask my patients to pick the date of their birth. So I was born on the 16th. On the 16th of every month, I feel my breast. We don't want you to diagnose. That's our job. We want you to tell us if there's something there that was not there last month. If we wait a year in the high-risk population that we serve, then we are already behind the 8 ball when we see you. So even though Dr. Powell is awesome and the radiology department is able to detect and they're very sensitive, there's nothing like knowing your own body.
I love that. Can you say that again? It's the most important?
It is the most important because we have access to our own breast. And again, I don't want you to diagnose it. Just tell me that you didn't feel it last month. And that's a reason enough for us to do a study, a test, to see if it's benign or whether it's something for us to be concerned about. We can't wait every 6 months, every year in the populations that we serve.
Your life is too important, and what we're looking for is lumps, different texture, a mass.
So you're looking for anything. So people say, well, I have lumpy breasts. Well, if your breasts are standard lumpy, then if you feel anything in addition to that, we need to know about it. So that's a phone call to your doctor to say, listen, I felt something in my breast I didn't feel last month. I just want to let you know, right?
That's
Take
good.
the burden off yourself, but let your physician know.
And Dr. Powell, you really do have a team approach. So if a woman goes to you at Providence or Dr. Fripp, they're going to have a team of experts behind them.
Exactly. It's nice to have everything in one location so they can get their imaging, and then if need be, see surgeons and adjunct medical doctors such as oncologists or radiation oncologists as well, all in the same place.
Well, yeah, you don't want to be driving around town when you're dealing with something like your health. And where do we go for more information if we want to contact you in Providence Health Systems?
Well, I would have people call the 202-854-7000, which is our main number. And then the hospital has a website as well that they can always go on and get more information. We'd love to see them.
Well, thank you so much. The website is on your screen. Make sure you look them up online or give them a call. Thank you, doctors.